My name is Gavin Dawson, and I take care of client relationship here at Sparity. I have the distinct pleasure of hosting today's webinar along with Jeff Surat, our head of cybersecurity practice. So today, Jeff will be sharing his view and his experience in the space. So let me give you a very quick introduction about Jeff and a quick background about his profile as well. So Jeff is a veteran in the space with over 20 years of experience working with various government, public, and private companies in the areas of cybersecurity. Before joining Sparity, he worked at the Naval Criminal Investigative Service, that is NCIS, where he held roles in counterintelligence, force protection, and also collaborated with Defense Intelligence Agency on supply chain risk. So throughout his career, he has concentrated on threats from Russia and the Asia Pacific region, covering counterintelligence and cyber activities of cybercrime, studying their intent and analyzing the tradecraft. So this is a very quick introduction about Jeff. Jeff, hope I was able to give a quick summary about your profile and I didn't miss anything.
I guess good evening, everybody. I am currently in Japan, so it's very early morning for me. But thank you, Gavin, for the introduction. As he mentioned, I've worked cybersecurity for 20 years and had the distinction of working in Asia for numerous years doing cyber threat analysis.
Perfect. Thanks, Jeff. So let me also introduce you Sparity, who we are and what we do as a company. Sparity, we are a decade-old global technology company with core expertise in assisting our clients to transform digitally. And also the important thing is enabling them to secure their application or organization from cyber threats. We offer our services to startups, enterprises, and social institutions. And talking about our geography locations, we are headquartered at Atlanta, Georgia, and we have one more delivery center at Dallas, Texas, and then in Hyderabad, southern part of India, and the last one at Sydney, Australia. So in total, we have 4 delivery centers, 2 in the US and 2 at the Asia Pacific region. Currently, we have about 200 plus engineers where we have delivered more than 1,000 plus projects across various industry verticals that includes healthcare, transportation, logistics, marketing and advertising, and to name a very few. So let me talk about the services offerings. I'll keep it as short as possible. So we are a technology agnostic company and specialize in 5 areas. The first one is cyber security. Second one, application development and maintenance. Third, data and analytics. Fourth, artificial intelligence and data science. 5, cloud and infrastructure. So these are the 5 pillars or the 5 services offerings that we offer under Sparity. Our engagement models are very flexible to meet our client needs. So this is a very quick gist about Sparity, and without any further delay, probably let's get started to today's webinar. Prior to that, just a little housekeeping. If you have any questions during the presentation, please type them in the question box or in the team controls panel. We'll address all of the questions at the end of the webinar. So Jeff, I think we can get started. Let me quickly give you about the backdrop of, my understanding of how healthcare is the second largest target. So when I was doing a lot of research, I came across and found that cybersecurity intrusion pose risk to every healthcare organization in terms of compliance, PHI data, and reputation. Healthcare, I've seen that has quickly become an attractive target to cybercriminals, mainly for 2 fundamental reasons. Firstly, it is a rich source of patient data, and secondly, most enterprises are vulnerable to any breach of PHI data. So having said this, yeah, I would like to again reiterate that healthcare is the second biggest target of cyber attacks. So can you please share me your view on the threat landscape in healthcare?
Certainly, Gavin, and thank you for the description on Sparity. So very quickly, I just want to go over the current landscape as it is. So over the last 2 years, polling suggests that there have been 4 and 5 attacks against doctors themselves. And recently, the average cost of a healthcare record has actually gone down to $250, where it used to be in the $400 range to purchase a healthcare record. Without going over everything on the slide, I can just add that the global data breach cost for a company is about $3.86 million. And that is based over a 9-month study over the last year. But in the US, it's actually gone up to about 8.64 million on average. And then as you can see, the overall is about $6 trillion spent going into 2021, just damage due to cybercrime, with a $1 trillion spend worldwide as defensive. Ransomware attacks in healthcare this year have had a very large increase. Most recently, the University of California had a breach that cost them $1.14 million. The reason for this is because they didn't have the ability to quickly adapt or the backups necessary in order to roll back what has happened, and they were largely focused on COVID-19 research. Excuse me. And secondly, Laporte, they actually had an interesting cyber breach that actually used various forms of infection and distribution of the malware. This came pretty much within the last month and a half, and they too had to pay $130,000. Likewise, just calling your attention very quickly over to AMC Corporation on the far right. They were breached by Russian cybercriminals, and they ended up having to pay money, unspecified value, to get the records back, but it was 20 million records. So for this year, it was the largest number of records that were actually held in ransom. The healthcare breaches reported in 2020 have spanned all the way up to 1.531 million records, but then there was a drop in April 20th and again a rise in May 20. The reason for the lack of information is because sometime in June and July, Health and Human Services stopped obtaining information, probably because of the shutdown and the lack of employees actually working in the office. But primarily, I want to point your attention to Missouri. Missouri's infection was actually due to a third party and resulted in a breach of 19 related hospitals. So in this case, the attackers didn't go for the small fish, they went for the big fish, knowing that if they breached one, there were chances to get more than one, or at least all 19 to 20 of their clients, and they did.
Jeff, really the facts and figures shared are really frightening, but it also makes us realize the importance of cybersecurity and why healthcare providers need to prepare and safeguard against cyber threats. But if you keep seeing or if you keep watching the healthcare industry, how it's been evolving, technology has played a drastic role. Healthcare organizations are adapting to new needs of patients by leveraging technology. That includes internet-enabled devices. Then you have virtual diagnostic, telemedicines, EHR systems, and so on. But on the other hand, if you see the recent attack of COVID-19 and other demanding patient needs, can you talk about the changing business model and its impact?
Yes, thank you, Gavin. So the business model, as many of you recognize, has changed over the last 6 months. And it's forced just about every corporation to either shut down or corporations work from home. And it used to be that the study suggested that 20 to 25% of employees work from home. And now that number is of course flipped, and it's more like 85 to 90%. The response to working from home beginning back in February, March, caused a lot of, we call them shadow IT organizations. So people had to randomly report to home, and they probably only had their laptop or the basic laptop issued to them at the office. But in many cases, people were unprepared for this. So that's what we call it shadow IT, meaning there was connectivity. It wasn't perfect, but it was there and people could work. This caused a lot of deferred patches, a lot of critical company assets to possibly be exposed, and deferred over the last 6 months every type of testing that should have been done. So HIPAA reporting, PCI DSS audits, pen testing for companies that qualify for pen testing. All of these things have been deferred, and Health and Human Services actually issued an advance in March saying, please go ahead, it's okay, we know you're going to be late. This situation will eventually take care of itself. But what they didn't take into effect is that if they give that announcement to everybody, that means everybody's third parties are also doing the same thing. Everybody's third parties are also being forced to react as opposed to, have business as usual. Over time, this is probably going to change. I know many organizations have said work from home is fine all the way to 2021. I know Google was the most recent company to make that announcement, and some of the healthcare companies in California and Seattle have said the same thing. But the issue is been logged as unreported blips, and those are basically things that have been reported and usually would have been looked into by a threat hunter. But since everybody is so remote and the population has shifted so much as far as who's working where, they haven't had time to look into those logs. In some cases, the logs actually are in the office without direct access of somebody going into the office. The changing business model also caused issues with communication. So you're in the office, you need to have a meeting, everybody's called to the meeting. You have to dial in a third party, you have a secured line to do that in your conference room, in most cases. In this instance, again, Health and Human Services had to intervene and say, you can use things like Google Hangouts, you can use Zoom, you can use Facebook Messenger, you can use FaceTime, Teams, which we're on now, or WebEx. Those are the only secondarily approved applications that can be used, and they specifically said, do not use Facebook Live. And that is because it's not encrypted in any way. At least not AES 256 encryption that's required for healthcare communications. And one of the issues they faced early on was they said, okay, you can use Zoom, but many people pulled Zoom down and they used it as the unpaid version of Zoom, which means it wasn't fully encrypted end-to-end. Likewise, if you had the fully encrypted end-to-end, it was only using AES 128. And in some cases, the patches, there were 8 that needed to be done. And in May, they found out that patients' records, personal private healthcare information, had already made its way out into the wild and was being sold. During this research, they also discovered that there were about 2,300, I put 2,300 even, should put approximately next to it, compromised Zoom credentials, and also there were compromised Zoom chats. So saved chats or chats that somebody would have intercepted were out there on the wild for anybody to see. And that also caused a lot of data breaches to happen later on as things progressed during the situation.
Yeah. This gives a fair understanding, Jeff, on the changing business models and some of the disruption that COVID has caused. However, can you just elaborate a little more on the threat landscape in an enterprise and how to confront them?
Certainly. So threat avenues in an enterprise have changed dramatically because of the work from home situation. And keep in mind, I'm gonna continue to say third party because this is a large issue. So you have everybody, including your third parties, working from home. And you'll also have new players in the game, and those are your family. So most of your family have not had the type of training that you've had. They haven't had the security operations training. They haven't had to do the yearly check here or the checkbox to say you've had security awareness training. So aside from the typical internal threats, the management that are targets, the administrators that are targets, your contractors that are targets, you also have increased your external exposure. So your business partners have the same issue, competitors have the same issue, suppliers have the same issue. So it's pretty much amplified across the board. And again, I listed family as external. So what I did is draw this next slide as an example. So, and this can be, plug and play using the different icons. But for instance, you have company A, they have third-party providers, they need to communicate with you. So they send the email, it goes to your system. Company B reads the email on arrival to their system, and then you've just sent them a phishing attack. So that means two things. That phishing attack can go backwards to your network devices based on them replying to you, and it can go forwards to their computers and cloud resources. Also, the attack could have arrived at the server on the company A side and gone directly through their network to their computers and resources. And that depends on what type of threat it was and what malware they used in order to perform the act. So real briefly, we'll go over the typical, I guess, the bad actors for healthcare as it is today. So Russia is a big contender, and they are because if you look down at the bottom, their threat is sponsored by the GRC and also the Federal Security Services Bureau, FSB. They run Advanced Persistent Threat 29, which has been an organization that I've been working against, dealing with for well over 12 years now. They're referenced as Cozy Bear, and they're special because they actually have the chance to dual hat. During the day, they work for the boss. At nighttime, they work for themselves. So they're a cyber threat actor, but they're also a cyber threat criminal. And because Russia's recovery has been so slow from an economic standpoint for this year, their actually revenue growth has been down about 45%. So this has driven them to do a lot of intellectual property theft. So not just COVID-19, but medical devices themselves, pharmaceuticals, random assorted electronics that are assorted with hospitals. And all of these measures have been to take information, use it for themselves, and then also monetize the information on the dark web. Another reason for this is because from the cyber counterintelligence side of the house, they already know quite a bit about all of us. And so any of the information that they take, they can store, they can sort it, filter it with information they already have. So for instance, if you're a person who has, let's just say, a sick relative, and you don't have the money to help that relative out, but you happen to go into a country that's largely controlled by the FSB or GRC, they know you're coming. They can actually meet up with you, talk to you, and say, oh, well, if you do X, Y, and Z for us, we can give you the money or we can help your relative out. So this is also true of China. So China in 2020 had to start what they call their 5-year plan. And the Bureau, all the cabinet members, did not have a chance to meet because it was supposed to be in February, March, And it didn't happen because they couldn't meet head-to-head and they were not willing to do the meeting virtually. So part of what their plan was to make sure that over the next 5 years they had 2.5 medical practitioners per 1,000 people, because the population is both aging and growing at the same time. So COVID-19 comes along, doctors, nurses, pharmaceuticals, they're no longer available. Many of them have probably died, been infected, will retire out early because of the situation. So part of their recovery is driven by having to spend money on a population that's aging without proper healthcare backing. So what they've done is have Advanced Persistent Threat 41, which also does espionage, and then at nighttime they work for themselves and do phishing attacks, ransomware, in order to make money for themselves. But actually, out of all the actors involved in this, China threat actors, APT41, are the most prolific, the most experienced. In some cases, we've had healthcare organizations who have been breached. About 55 days later, they'll know the breach, they'll do the patch, and then about a week later, they're back on again. And so, as far as the threat actor is concerned, these are the ones to watch. Now, keep in mind, most cyber criminals will run out of Russia, Eastern Europe, but you also need to pay attention to what's going on in China. And also with current activities, you definitely need to pay attention, because right now, China as a threat actor is about to move from number 2 to number 1 when it comes to healthcare, which will actually drive healthcare from being the second highest to the first highest, and will drive banking and financials down to number 2.
Absolutely, Jeff. I acknowledge your view on how people, device, and infrastructure are critical to prevent malware, and also importantly, the possible threats from Russia and China. But if you have noticed, in the past few years, many organizations have been targeted by cyber criminals. So, what is your perspective on cyber criminals targeting healthcare?
Well, as I mentioned a few minutes ago, ransomware is the number 1 issue right now against healthcare. The Ransomware-as-a-Service model is what's mainly being used, and it's important to understand that the information gathering takes several forms. So as I just mentioned, you have 2 large contenders in Russia and China trying to gather healthcare information and also trying to do the normal work for intelligence collection. And information on a target is evolving, and if enough time is allotted, like in the instance where they hack the insurance billing firm, they were able to do 20 eggs in one basket. They got the firm itself and they got their 19 clients. So you have, I guess, an instance where you're having to play catch up because you don't have all the resources that you would normally have. And the other issue too is this has been going on for 20, 25 years. And the large issue is still the employee, still the email, still the trick to get the person to click, which right now is all about the email related to COVID-19. In fact, myself, and I meant to post this on this presentation, I received an email from my company in the United States that does the healthcare billing for me as far as getting my 3-month prescriptions overseas to me here in Japan. And I read the email very carefully, and then I noticed the email was only about a page long, but I had a really long scroll bar. So I scrolled down the scroll bar, and I could see every other name that they were going to target, because for some reason, when they created that email, they kept the data in a spreadsheet or however they did it, and I could see everybody who was about to get attacked. So that's just one example. So when you're doing ransomware, it's usually a entity that wants to rent the service from the service controller. So they actually understand their target. They already know who they're after. And it's just a matter of what type of ransomware do they want to run. There's about 150 types right now. That may change. But usually they just take the ransomware, figure out what's wrong with it, figure out what defenses have been performed, and they'll modify the ransomware and they'll get right back in. And so as an individual, as a cybersecurity professional, you need to understand things like that are going to happen. And what you do about it is you, number one, make sure you have awareness training. Number two, you test and red team using high fidelity indicators. So that usually means you have to have somebody who's already studied your network, already has the network diagram, already understands the healthcare industry, and who might be after it. The two major players in Ransomware-as-a-Service right now are Boss Spider, which is actually a name given to them just as nomenclature that we could all understand. They're also known as SamSam. And they are the ones that will take your ransomware and will give you the bill that says, you know, pay us $1 million and you'll get your data back. And then they'll send you 5 freebies to show they actually have your data. And chances are they're willing to negotiate because on the back end, they're going to sell your data anyway. And they use very, very unverified methods to do that, meaning they'll go down into the dark web and sell it to the highest bidder. Again, most of this happens from Russia and Eastern European countries. And they'll only take payments in Bitcoin. Revel just made the top #1 list recently because of the last, I guess, 3 or 4 attacks they've had have been against large-scale companies. They've taken 1.2 terabytes of information from them. They've stolen gigabytes of data from, you probably all remember, the entertainment lawyer firm, and started releasing President Trump's information and several others bit by bit by bit because they weren't paid. And a lot of it, again, is focused on COVID-19. So understanding who your attackers are, what your threat model is very important. And again, this has all changed because of the new work from home, work from unsecured resources, and actually work with new people. Unfortunately, your family, your friends, who might be in the house with you while you're doing it. And so you have to understand the behavior analytics of the individuals that are going to be your threat actor. You have to increase the threat hunting and going after securing your endpoints because that's the first place you're going to hit. And you have to study the advanced methods that they're going to use. And all of this takes time, all of it takes resources, but it's well spent time, especially given the new normal what they have to deal with now.
Certainly, Jeff. Now that we have learned about ransomware as a service, could you also please shed some light on what are the best practices and how to prevent cyber threats?
Yes, thank you, Gavin. So the first thing you need to understand is your past and your present. And by that, I mean looking at the cybersecurity model that you might already be familiar with. And most industries have been a level 3, meaning they have defined practices, they have documentation, they understand the network, they have some degree of improvement over time. That's where many of the small to mid-sized businesses are going to fall. Unfortunately, everything that just happened this year may put you back into a 2.5-ish level. And the reason why I say that is because you can't really quantify your risk right now because of what's been going on. And you can't quantify your risk as far as your third parties are concerned. So a lot of the information is a very large magnitude loss, and you can't really derive your risk from the information that you have now because the entire environment has changed. So in many ways, you have to understand the reason why your companies, your partners have fallen back, and it's due because of the lack of time, lack of adjustments that they've been able to make regarding the mandated procedures, regarding healthcare information reporting. They've been unable to monitor the compliance, and likewise, they probably haven't had the compliance meetings that they would normally have. So going all the way back to a level 2 doesn't necessarily mean they've lost all their capabilities. It just means they've lost the ability to adjust to the information they may already have. It's just in locations that they can't access. So what that means is following a mandated procedure. Well, you can follow a mandated procedure, but if you can't actually go into the office to get your network diagrams, to have the meeting, then you're already non-compliant. So you just have to try to move forward as best as you can. And so when you look at what a maturity model is, it's your technology, it's your common elements, it's comparing yourself with other businesses in your same field, and it's understanding your industry adversaries. So like I just mentioned, the ones from Russia and China are going to be the key adversaries for just about every healthcare business there is. And to understand, you need to understand your log monitoring methodologies, and you need to start doing threat hunting. So just to recap, it's documenting the technologies in use, identifying the common elements, and compare your results with your industry. And many industries themselves have cybersecurity meetings. They have understanding of the different siloed businesses, and they will talk to each other and come together and say, oh, we just got attacked by X. This is what they did. This is how we think they got in. And you can actually compare and contrast that information and fully understand your silo. Also, you need to do a self-evaluation. So when the work from home, when the new normal started, typically the first thing that would happen in a large size organization or medium sized organization is they'll assign somebody to provide information to the C-level executives as far as what's going on. Let them do their typical command and control and try to point you in the best way forward. And you also need to make sure that your current cybersecurity policy reflects the new normal. So like I said before, if people are working from home that didn't used to work from home, then they probably haven't had cybersecurity awareness training. They probably don't know what they can and can't use as far as doing the assessments they're now supposed to report to. You also need to understand that people are going to be using devices from home that may not be standard to the corporation. So for instance, they might be using Apple products, they might be using Linux, they might be using different versions of Windows at home than they do at work. So understanding that is going to be a big part of how you protect the sensitive data, how your IT people respond to the call-ins and saying XYZ doesn't work. They're not going to have the scripts that say you're using Microsoft Word on an Apple whenever your entire organization is running Windows, but they're doing the best they can from home. Likewise, you need to rely on your healthcare manufacturers. So the MDMs, even though we're in this new normal and you're doing healthcare, the MDMs are responsible for remaining vigilant and letting you know when something happens to one of their products, one of their pieces of hardware. You shouldn't have to go to them. And reviewing on a weekly basis, so having somebody set up the meetings, having somebody do the teleconference to go over what may or may not have happened, because now you're geographically dispersed, you don't know what's going on in your office because you're not there. So having weekly meetings, follow-ups is also important. The key takeaway from this is, as a healthcare, as a healthcare security professional, it basically falls on you to make sure that you understand your internal and external relationships. Vendors can offer more operational help, but they require remote access to your information as well. So again, we're talking about the breaking down of communications to the barest bones level in order to keep operations going. They've had to do the same thing. So I know I keep harping on third parties, but it's important to understand that everybody's having to do the same thing you're doing, and it makes it hard. So getting immediate time to value information. So you may have accepted during your annual risk acceptance or annual risk tests, you may have accepted some risk. So say your previous risk was at a level 3, now you're working from home, it might be a level 5. So you need to make sure you're understanding immediate time to value information as far as what's going on. You also need to understand that threat intelligence is more than what you read from your IOC feed, so your intelligence operations feed. Because the information that you're going to get there may not be focused on your situation and your business model. So continuing to have people study and resource the adversaries, the campaigns, and their current attacks, especially now, since you're getting probably 8,000 COVID emails a month that aren't really COVID emails. You also need to make sure that your essential mitigation is still in place. Excuse me, losing my voice. So make sure you're applying the latest security patches as best as you can. Make sure your authentication credentials are reset. So keep in mind that when companies are hacked, the existing methodology, the existing user accounts that were hacked are usually sold on the dark web. So making sure that you rotate the passwords and making sure that your employees rotate their passwords as well. And the most effective way to mitigate a risk is by ensuring that the affected products supplied to you by vendors are also patched. So I put in the notes down here. Just in the last 2 weeks, Cisco, Pulse Secure, Fortinet, Palo Alto, hardware vendors have all released patches for their devices. Also, I included Baxter. Private note, my dad used to work for Baxter when it was Baxter Terminal. So all the devices that may be used in your hospital, in your office, that's produced by them, now have 3 updates that need to be processed, and they also have 1 update that cannot be processed because it's built into their firmware. So making sure you keep in touch with them, understanding and collaborating with third parties. And there is also a healthcare sector cybersecurity coordination center. It's called HC3. I don't have the URL, but if you contact us after this presentation, I can definitely give it to you. But basically, they're the ones issuing advisories based on certain products and taking the realism of the environment and compiling the information in order to send back to people who are members.
Jeff, thanks a lot for sharing your views and experience. I know with the current pandemic, certainly healthcare field is currently in an uncertain position. There are a lot of new technologies that promise to improve care or also improve success of outcomes, but those same technologies create vulnerabilities and also invite cyber threats that put every one of these agendas at risk. Also, on the other hand, the increasing sophistication of cyber attacks, competing goals focused on quality care, and the limited budgets that every organization run on can easily make security a very challenging aspect. Having said that, a sound strategy that implements some of the best practices covered today by Jeff can help you overcome many vulnerabilities, protect sensitive data and system, and assist in decreasing the number of cyber attacks. And most importantly, we can help you prepare for tomorrow's threats. So having said all of this, Jeff, could you share a views like how Sparity can help in terms of the cyber threats or help organization protecting from cyber threats or malware attacks?
Certainly. So Sparity has two arms in the cybersecurity. Sorry, how to scroll again. Two arms. So we have the consulting services, and we also have the staff augmentation side of the house. So speaking of consulting services, every one of our personnel has up-to-date certifications, mainly around network devices and certified ethical hacking, as well as virtual CISO offerings. And I'm not going to go over the entire list, but you can read that there is varied experience throughout the individuals within the organization. But most of us will focus on large-scale devices, your Fortinet, the Cisco devices, Palo Alto, and Checkpoint, as well as we also have, we've been talking about Wi-Fi a little bit. We have third-party agreements with an Israeli company that just offered a new device that actually monitors Wi-Fi networks and does security log monitoring that you can access yourself, and they're called Wi-Fi Wall. And again, so if you're interested in looking more into that, since you have the new work from home planning to work out, we might be able to talk about that as well. Likewise, over the course of my recent experience, we've been called in to talk to some upstream partners for IT and cyber. In other words, you have an issue, you have the IT people, you have the cyber people, but they may not have the experience in talking up. So we also offer performing custom briefings on your behalf based on the analysis to talk upstream to make them understand why XYZ needs to happen. And my personal example of this is very recent. Last year I was in Cambodia talking to the Ministry of Education, and they wanted information on how to set up a SOC. And I started talking to them, and the first thing I said is, well, you need to have people trained in, Cisco, you need to have people trained with CISSPs, you need to have other individuals, and they all looked at me like I was from outer space. And so I said, how many people are you willing to put into this SOC? Because you have to have SOC 1, SOC 2, SOC 3, and threat hunters beyond that. And so we ended up having to come up with a custom schedule, which has been disrupted because of COVID. But to set up a SOC usually takes about 14 months from scratch. So we ended up doing a development plan for them and setting us a scale that said, okay, when these people come online, group number 2 has to go through this training, get these certifications, and then when they come online, group 3 has to do that, and so on and so forth. Likewise, for consulting, on the consulting side of the arm, we have vulnerability scanning and assessment. So when we were talking about the cybersecurity model, this is where you cover CMM level 2 activities. So understanding your vulnerabilities, doing an assessment, reporting on those, setting up the hatching environment, setting up the staging environment, and then doing it again a year later. And so this is a repetitive model, and we'll get you from CMM1 to CMM2 based on the documentation that you have. And again, we have professionals, including myself, that can go through this with you. To jump from a CMM2 to a CMM3, then you start doing cyber attack simulations. So this is basically, for some cases, it might be a pen test. For others, it might just be a tabletop exercise. And then it goes over the primary business concerns that you have, the primary business concerns for your business silo, and tabletop-wise will emulate the attacks that you might face based on what you have on hand. My largest experience with this was when I was within CIS, and they have a annual attack simulations both for land, sea, air, and cyber, called LG Freedom Guardian. So when I was in the bunker for 2 weeks, this was all we did. We had role tabletop exercises of, bad threat actor, usually North Korea, did X. How do you defend doing Y? And so on and so forth. And then when you're a CMM level 2 or 3, you want to jump over to a CMM 4 or actually just get better at your CMM 3. Then you go into full penetration testing. And this, again, is usually done from an external person. Could also be done by your own people, but they have to be outside to do it. And likewise, you want this to be as real as possible, so you have people who are out of the country doing it. And this is definitely something we can do. We have resources located in the US, and we have resources in India as well that can perform penetration tests for you, provide the reporting, package the entire thing up, and provide it to you. And the important thing about packing this up is, we talked about audit and security, and when you do a penetration test and you have all the information, you can actually use that for ITIL reporting. You can use that for your HIPAA compliance. You can use it for audit compliance. All of that information can tie to other types of compliance and reporting that you might need to do. And from a reporting structure, this is something we have modeled. We understand all the threats. We have all the updated PCI, DSS, everything documented, and we can take your results and put it into a spreadsheet or document and map the entire thing out for you. The map also includes ISO 27001 and related reports as well. So basically, I call this 2 birds, 1 stone. Basically, this is more like 4 birds, 1 stone, but it's definitely a way to